So as we well know, today, there is a big push for meaningful use reimbursement by the government, by the Office of the National Coordinator. And most of the healthcare organizations are trying to figure out what systems do they need to implement to meet the initial requirements that are set between 2011, 13, later on 13 to 15, going more into more aspects of clinical decision support, high acuity, and then between 2015 and after to implement more computerized physician order entry, clinical documentation for physicians, and more aspects of knowledge-based prompting within clinical decision support. The reality is that what hospitals need to do right now, if it took us 15 years to deploy core components, core systems within the hospitals, and after all this time, the adoption rate for high acuity areas, those areas where you have the most meaningful data to meet the requirements for meaningful use. The reality is that if hospitals really want to meet those deadlines and be able to qualify for the reimbursement programs, and of course implement the systems before penalties apply, what they need to do is look at their infrastructure that they have today and realize that by optimizing that existing infrastructure, they will be able to meet already the requirements for 2011 to 2013. That the reality is that they need to start covering the holes that they have within the organization. And those holes, as I mentioned before, they are primarily in the high acuity areas. So if you optimize the existing components, already meet the requirements for 2011-13, 2013 reimbursement, and apply those funds to cover the holes on high acuity, hospitals should be able to meet by 2013 probably all the requirements that are needed even for 2015 and later. So where do they start? You need to start a parallel process where you optimize what you have rather than going out and selecting a new vendor to provide all your core components. And at the same time, they need to start a clinical transformation process on bringing high acuity, best of breed systems and emerging technologies, and guarantee that there is going to be interoperability. That is going to be the biggest challenge. As I said, not so much technical, but more on the political side.